Hi, I am here today to share with you the differences between hospital, birth center, and home birth, some of the pros and cons. You may already know where you want to give birth, but this might just sort of raise your confidence in your choice and give you more information about what you're diving into. Or if you don't know yet, you'll love this because then it will help you make your choice. So with a home birth, we'll start down here. One of the pros is that you do not need to worry about when you need to go to the hospital in labor. The midwife comes to you, you don't hop in a car and go assess where you're at in your labor process. They might come and go if you're in early labor, but you just get to be in your bubble, in your nest, in your home, and progress without any sort of interruption, like a car ride. Whereas if you're going to a hospital or a birth center, you might go, and if you're in early labor, have to go back home, and that might even happen a couple times. Hopefully not. I'd say that drive back and forth is usually bothersome and uncomfortable, can slow things down, but not always. Sometimes people don't mind that drive and it's not that big of a deal. Maybe it even helps them, with all the bouncing, progress a little. So everyone's different, but I do think that it's a bonus when you birth at home that you don't have to think about that travel and feel nervous. Like, what if I give birth in the car or at home? Or that's your intention, to give birth at home, right? So the appointments, another bonus is that they are very cozy. They're usually in an office that has nice couches, beautiful artwork, very tailored to the kind of experience that you're, intending on having, with books and movies and resources usually that are available to you. But definitely just like cozy couches and a comfortable place to be. Those appointments are usually about an hour, sometimes longer. Where there's everything from childbirth education to nutrition education, postpartum discussions and preparation, and then just like your prenatal visit. My cat is saying hello. Naturally minded. So the licensed midwife that's going to provide this care is going to be naturally minded. She doesn't bring epidurals in her bag, and she certainly can't do a cesarean. All of her tips and tricks are going to be naturally minded. So herbs, aromatherapy. She does have medications for emergencies, but as far as getting labor to progress quicker or anything like that, or like I said, more comfortably, it's all going to be natural tools. And then as far as paying for this service, it's either going to be cash pay or insurance. Usually though, you're going to have to pay something cash up front, either a deposit or the full fee that will later be reimbursed, hopefully, when insurance pays that money. Postpartum, this was to remind me to tell you that postpartum, the midwives will hang out for a few hours, as long as needed, really, to make sure that mom and baby are stable, and suturing is done if that is needed. Of course, if there's any reason to transfer to a hospital, they'll do that at any point. The care with a home birth midwife is usually provided by one or two midwives. At the birth, there's usually two people. But the care is usually one midwife or maybe a small team. Birth center. So birth centers are lovely because they have a very cozy environment, and they are going to be naturally minded as well. There's no epidurals we're talking about out of hospital freestanding birth centers. Some hospitals say, oh, we have a birthing center, the birthing unit. That is different than what I'm talking about here. I should have put the word freestanding because it is separate from a hospital. It's going to provide, like I said, a real cozy environment. They usually have birth tubs, big beds, just nice decor, and really with that intention of having someone feel like they're at their home away from home. And again, no epidurals. It's going to be the same type of herbal, natural stuff that I talked about with these home birth midwives. Sometimes birth center midwives will even offer a home birth option. They will also accept cash or insurance pay, same as how I talked about down here, with a deposit or full pay and reimbursement once insurance pays out. The birth center teams are usually a bit bigger, 3 to 5 midwives, although that varies depending on the birth center. Same as a home birth, but with a birth center, you're going to be driving home. So you'll be there for a few hours, up to 6, 7, 8 hours, just depending on what the needs are for you and your postpartum time. But then you will be able to go home usually same day. I mean, it's always the same day unless it's in the middle of the night, right? And then it might be the next morning. But these midwives here, they're going to do a home visit, 24 to 48 hours at the most postpartum. So that's the difference. Is the hospital, you're going to be staying there for a couple days, but these people will come to you in the next day to check on you and provide all of the testing that's done at the hospital. Just I'm talking about the standard tests, like the newborn screen. It's like a state newborn screen. The CCHD screening. These should be offered through these providers, but they'll just bring it to your home instead. Now, of course, these providers don't do some things postpartum that a hospital does have, like hearing screens. These guys don't usually have the hearing screen equipment. So if that's really important to you, you want to find a way, if you want these types of births, to get that done. So you'll want to ask your providers, if you choose these places, what do you not offer postpartum that the hospital does? What should I, like Hep B, out of hospital licensed midwives are not, it's not within their scope to do any vaccinations. So you're not going to get those through this care. You'll have to go to a hospital or your pediatrician for things like that. Some of the cons, or maybe another con of these types of births, is if you have gestational diabetes, preeclampsia, hypertension, or any other complication outside of normal. And there are some things that are, like things we can work with. Okay, let's say you're pregnant and it's pushing 42 weeks. Well, in the state of California, we're not supposed to do births at home after 42 weeks, but there are some things we can do to hopefully get you to deliver before then. Let's say we do the glucose testing and you are borderline diabetic. Well, we're really great at counseling clients with nutrition to prevent gestational diabetes from actually setting in. So we try to prevent those complications, but if they do show up, we have to transfer care to an OB and recommend hospital birth instead. So hospital birth, the appointments are much quicker. My R got erased here. Are much quicker, 15 to 30 minutes usually. And they often involve a quick ultrasound or we often have ultrasounds, but I just want to say it seems like they do them just much more frequently at visits, like quick ultrasounds at hospitals. But yeah, they offer more interventions. So they have a lot of induction medication that we're not allowed to give. It's not within our scope. We can do herbs for induction, but the hospital can use Pitocin, misoprostol, etc. They have various ways of inducing. They really can tend to high-risk clients. Preterm labor is something that they're going to be more apt to handle. The epidural, they have, and obviously cesarean. This is where you would go for that. Some states you can have an out-of-hospital birth with twins or breech babies, but some states you are, legally not supposed, or let's say like a licensed provider, a licensed midwife. A doctor can actually offer out-of-hospital twin or breech deliveries, but a licensed midwife is not supposed to offer that out-of-hospital in California. Whereas at the hospital, they can do that. But there's more to those topics, which maybe I'll talk about in a later video. At the hospital, you will not get care from a licensed midwife, but you will get care from an obstetrician or a nurse midwife. I don't know why I didn't put that on here. At the birth. And largely at the birth, you will get your care from registered nurses, from nurses. So the nursing team at hospital really walks you through your labor and your delivery. The OBs and the nurse midwives will come in towards the end, although they will, for that ongoing care, they will check in with you periodically throughout your labor if it's long enough. Where at the out-of-hospital setting, the licensed midwife is the one that's with you the entire time and delivering your baby, and she has at least one assistant. And then after your birth at the hospital, you'll stay for a few days. You can try to leave earlier, but they would really rather you stay for a couple days. And obviously, if there are complications, then it's smarter to stay for a couple days. So, and they accept insurance, and usually without a deposit, although your insurance may not cover the entire birth. And obviously there's deductibles and things to consider as well. Now, looking at the out-of-hospital birth schedule, and this might be applicable to hospital birth as well. It's similar, but they might have more things that they would put on this list. So, for my care, for example, and a birth center, you're usually going to have your initial visit between 8 and 12 weeks. At that point, you have the option of getting an early ultrasound, and we will draw your initial labs, a blood draw, which will cover all sorts of things that help us just feel like you're, healthy, and there's no obvious risks to baby as far as any illnesses that maybe you didn't know about. Pretty rare stuff, but it's good to just rule it out in a lab and to know, your iron levels, your platelet count, and stuff like that. So that's all done at that initial visit. The early ultrasound, you would go to a radiologist, a place that does ultrasounds, but we would get that ordered for you if you wanted it. You'll have a 16-week appointment. So every 4 weeks up until 32 weeks, you'll have monthly appointments. At 20 weeks is when, between 18 and 22 weeks, the anatomy scan is done. So for people who want an anatomy ultrasound, it's a longer 45-minute ultrasound that really looks at different parts of the baby, the fetal anatomy, to make sure that, everything's okay or address issues if they are there. At 24 weeks, we come back for an appointment. 28 weeks is usually when the glucose testing is done, and another set of labs, which doesn't only focus on iron levels, but that is one big thing we look at. So that's for the gestational diabetes. In my care, this is, you can decline anything, but I really recommend getting a CBC at this point, a complete blood count, which will show me that your iron levels and your platelets and just the overall picture of your blood is healthy. 32 weeks. Oh, I want to say the reason also that declining this, I don't want to just say that, like, it's not that simple. We talk about nutrition, we offer options. So you may decline sort of the mainstream testing, but you choose to do a different testing that is equally as, arguably equally as reliable and helpful in determining if any sort of glucose intolerance is happening. 36 weeks is when I do my birth plan with clients. We sit down and talk a lot about the birth and what they're hoping for and what options, they have that maybe they didn't even know about, and that's usually when the GBS test is done. Could do a whole video on what that is. Essentially, it's a genital swab. 37. So now we're at weekly visits, 37, 38, 39, and 40, 41, etc. Oh yeah, you can see that. Postpartum, out-of-hospital midwives offer a day 1 to home visit, usually a day 3 to 5 home visit, somewhere in that range. So 2 visits there, and then 1 week, 2 weeks, 4 and 6 week visits. In-hospital care does not provide this many visits. It's usually just a week 6 and none of these. However, remember, you are staying in the hospital for a couple days. So if you are delivering through the hospital, I really recommend doing a postpartum planning session with someone who can help you feel supported in this time, because that is a huge jump And a lot of people have trouble breastfeeding or give up breastfeeding because they don't have that support. Hopefully everybody has easy breastfeeding experiences, but that is generally, not for everyone the case. So that is my spiel, 15 minutes about in and out of hospital care, and a little dive deeper into what out of hospital midwives and even some hospitals, offer in terms of the visit schedule. Definitely if you're choosing a hospital setting, don't rely on what I just said about this side of the board. You'll want to ask them specifically about what they offer. And as always, this is general. There's always more information, and depending on who you work with, they might have more to say about the care that they offer. So this is just a snapshot, and I hope it helps.